Thank you all very much for joining us for today's podcast program brought to you by ACRO. I'm Fraser Cobb, the Executive Director of the organization, and we're pleased to deliver this program with an update from accreditation. I'd like to introduce today's host, Brian Lally. Dr. Lally is a board member of the ACRO Board of Chancellors and will serve as our host for tonight's program. Brian?
Thanks for the introduction, Fraser. During today's program, we'll be discussing the new partnership between the Radiosurgical Society and ACRO, and resulting in the development of a special distinction in stereotactic radiotherapy. We have three guests with us today who have intimate knowledge of this new program and the vision behind its development. First is Dr. Heppel from Brown University. He serves as the medical director for ACRO's accreditation program. Second is Simon Lowe, who is the medical director for the distinction in stereotactic radiotherapy and is from the Radiosurgery Society. And last is Dr. Stanley Benedict, who is the physics director for the Radiosurgical Society Distinction in Radiotherapy program. Thanks for being with us here today. I'm looking forward to learning more about this program. But I'm going to start with Dr. Heppel. Jarek, can you start by telling us just how you set up the foundation for this program? Give a little bit of the background and the history of the ACRO accreditation program, and how you think this new program is going to be involved with ACRO accreditation and evolve over the coming years. What sets it apart from other programs?
So let me start by giving a little history of ACRO accreditation. ACRO accreditation has actually been around for more than 25 years. ACRO as a society in 1995 saw that there was a real need for an accreditation program that was really specific to radiation oncology and not to other subspecialties. And ACRO at that time first developed the ACRO accreditation program. The program has undergone many improvements over the years. In 2010, there was a significant improvement in the program under the direction of Dr. Kettle. At the time, we developed a whole new program, which was really designed to bring our accreditation program into the modern era. Part of this was to move away from paper chart reviews and really modernize the process by having the process almost entirely electronic. I took over direction of the accreditation program in 2016. And my goal and vision for ACRO accreditation is to have ACRO accreditation be the best choice for practice accreditation for radiation oncology. And what ACRO offers is really a comprehensive review of all of the QA standards and radiation protocols and processes for practice. What really sets ACRO accreditation apart is that we have a very transparent process. All of our standards are clearly defined, and all of the reviews are given to the practice so they see exactly where the practice has shortcomings so that they can improve the practice. But this is really designed to minimize any bias in the review process. Additionally, ACRO accreditation is practice focused. We really want to help practices update their standards to the most up-to-date QA processes and treatment approaches. We're really focused on helping practices achieve this. A reflection of how high quality our process is, we actually in ACRO accreditation are the only accrediting body that is actually ourselves accredited by ISO. And finally, what's really sets us apart from other accrediting bodies is we are really looking at innovating accreditation, bringing it to modern times and modern processes. And this partnership is really a reflection of the innovation that we're seeking with ACRO accreditation.
Thanks for that background, Jarek. I wanted to next ask Dr. Lowe and Dr. Benedict if they could discuss some of the initial stages of this partnership and how RSS became interested in working with ACRO to offer the special distinction. But before they get into that, I wanted to first ask Simon if he could tell us a little bit about the jerseys over his right shoulder.
The red jersey is the away jersey for England, and the orange jersey is the home jersey for the Netherlands.
So can you tell us, since we have all these soccer fans on this call today, maybe we should get back into talking about the RSS and ACRO accreditation program. I'll let you guys talk about that. But at the end, I promise we'll have some talk about soccer and let you and Fraser go at it. How does that sound?
That's good. So the Radiosurgery Society, also called RSS, is a multidisciplinary nonprofit professional medical society consisting of radiation oncologists, neurosurgeons, surgeons, and medical physicists, as well as dosimetrists, nurses, administrators, and healthcare providers dedicated to advancing the science and clinical practice of stereotactic radiosurgery and stereotactic body radiation therapy and advancing therapies. And the purpose of RSS is to champion the evolution of science, clinical practices, and technological innovations in the field of SRS, SBRT, and advancing therapies by providing an international forum for collaboration and education, and encouraging global adoption of techniques offering optimal safety and efficacy for patients. So in 2020, ACRO recognized the rapidly changing landscape of radiation therapy with exceedingly more radiation centers offering patients SRS and SBRT. However, there were no accreditation programs specific to SRS and SBRT. Therefore, it became the goal of both organizations to work together to develop a comprehensive accreditation program specific to SRS and SBRT, clinical practice, and physics quality assurance. So Dr. Stan Benedict can talk a little bit about the physics piece.
Yes, so actually the RSS has a long and well-established record of working on improving quality assurance and quality improvement for stereotactic radiosurgery in concert with other organizations. One example of that is the AAPM RSS Medical Physics Practice Guideline 9.8 for SRS and SBRT, which was published in 2017. And this is actually a nice guide that will be used in part for this ACRO distinction by the physicists.
Stan and Simon, that was a lot of great information. I was wondering if you guys could tell our audience today, why should practices seek an ACRO RSS distinction in stereotactic radiotherapy?
The key thing with seeking distinction is for not just necessarily quality assurance, and to know that what you have been doing is in accordance with the established best practices, but where your roadmap of the future is. Where are you going with your next technological resources and investments? And having access to experts in the field is very, very instructive and helpful in that regard. So not only can one do an assessment of their practice, but they can also get advice for quality improvement for the future of their programs.
So as the field of SRS and SBRT grows, the availability of an accreditation program specific to its unique requirements becomes even more important. This accreditation option is a great way for practices to independently evaluate their radiosurgery programs and showcase their expertise. It also helps patients and caregivers identify centers of excellence.
So it sounds like this would really improve the outcomes for our patients. Jarek, do you have anything else you would like to add?
Yeah, I just would like to point out that there's no subset of radiation oncology that has been evolving faster than radiosurgery over the last few years. There's ever evolving indications for radiosurgery, and the technology and the precision with which we deliver radiosurgery is continually improving. And to be, for practice to be up to date on the latest quality assurance to ensure that their patients are getting the best treatment and the best quality care, I think is very important. And that's what the RSS ACRO distinction helps provide. The other thing I want to point out is, this distinction is really a gold star for a practice. This really is designed to showcase that a practice has a specific expertise in radiosurgery, something that the practice can showcase and be very proud of, to distinguish that practice from other practices in the area that may not have this kind of expertise.
That's really good information. Thanks for that. I don't want to get into weeds and get lost here, but I was hoping the three of you could give us a little bit insight into what the review process that has been developed looks like. What are the standards for this stereotactic radiotherapy distinction? What can programs expect with regard to the medical chart and physics review that they are being asked to undergo? And how does this distinction extend ACRO's accreditation for a practice?
So let me start by talking about a little bit about how this couples with the standard ACRO accreditation. So practice seeking this distinction would apply for both standard ACRO accreditation and the distinction. So they would undergo standard accreditation process. That involves three pillars or areas of review. One is the administrative review. The second is the physics review. Both of those are done either through an on-site visit or more recently through a comprehensive virtual visit, which is as comprehensive as the site visit. The third aspect of the review is the medical chart review. This process is entirely digital. We no longer sit in a room with a bunch of paper charts. We've modernized this process. And by doing an entirely digital review, we're able to organize our reviewers into disease site-specific teams so that the reviewers have particular expertise in those disease sites, as well as the ability to re-review charts so that there is transparency in our review process and elimination of bias. The way RSS ACRO distinction couples with the standard ACRO review is that they will happen at the same time. The physics review, the virtual review will occur in conjunction with the RSS physics review. So there isn't any additional time that the practice needs to put in. They will just address the different aspects of the criteria. As far as the medical chart review, that is also coupled together, meaning that we will select charts that are specific to radiosurgery that's being sought after for the distinction, and those will be used for both the standard ACRO review as well as for the distinction in radiosurgery, so that the practice does not have a redundancy in what they need to do to achieve both ACRO accreditation and radiosurgery distinction. And maybe Simon or Stan, you can talk a little bit more about the specifics of the criteria for the RSS distinction.
Yeah, so for the medical chart reviews, we've determined that since this is a new program, we will focus on 6 commonly treated disease sites, which include CNS or brain, spine, liver, pancreas, and prostate. And each disease site has a dedicated review team and a team leader. For each center, a minimum, no matter how many sites are being reviewed, a minimum number of charts being reviewed will be 5. And with at least 2 charts per disease site. An attempt to represent a patient mix of practice will be made by the accreditation staff when selecting charts to be reviewed, as indicated by Dr. Happel. And the reviews are scored against established chart review measures. And these measures have been developed by the disease site teams, which are thought leaders and experts in the field of SRS and SBRT. Clinical performance measures, including the documentation of the clinical parameters and the technical aspects, will be evaluated and scored for each chart. If a minimum standard is not met, a recommendation for provisional accreditation may be given for this section, and the concerns and recommendations will be communicated to the center. And if the center still fails to rectify the issues, a destination of a denied accreditation will be given. So in terms of the specifics of the scoring, what is different from the ACRO scoring itself is for this SRS-SBRT distinction in practice accreditation, for each chart, the center has to get at least 80% of the designated full score for the technical component in order to pass, and the minimum passing score is 80. So, Stan?
So as Dr. Heppel described, the physics component, it will be entirely in participation with and in unison with the ACRO physicist, who will be on site or has been virtual in these last year or so. And so we would participate, either one or two of us from RSS, during that component, during that portion that will have Stereotactic discussed. And we would be available to not only review the program, make recommendations, and discuss the roadmap of future changes that might be of interest. But it would basically be focused on that particular area by the physicist.
That's really great information. It's a way to recognize how great some of our practices are. I wanted to ask everyone where we are with the rollout of this new distinction program, and how is this being received by the membership of both organizations, ACRO and RSS?
So I can start addressing that question. I think we've rolled out the program. The program is currently live, and it has been very well received, and multiple practices have been interested and have already enrolled in this process. Two practices are currently in the process of review, and there are several practices that are in queue. So practices across the country have been very excited about this program, and we're very excited to offer it.
And no question, RSS is indeed excited about participating and continuing with this wonderful partnership.
Yeah, I trust that with this partnership, we'll be able to advance the field of SRS and SBRT by improving the quality of the process itself and multiple centers getting involved in this program.
Okay, that's really good. Before we wrap this up, I did want to come back to one question. With this panel that we have here today, are there any predictions for who's going to win the next World Cup?
England.
Fraser?
I have no comment on that. I don't want to get in trouble.
I think I would have to go with England as well.
All right, so it looks like, Jarek, what do you think?
I think it should be USA, but they're struggling on the world stage.
Yeah.
So probably Brazil.
Oh, yeah. I'll go with Brazil. So it's
Yeah.
Brazil and to England.
I think football is coming home again.
Oh, I can't wait to be back in person with everybody again. I'm so excited to have those days come back. This has been a terrific podcast today. I just wanted to make everyone aware who's listening to this that additional information regarding this ACRO RSS distinction and stereotactic radiotherapy can be found at www.acro.org/SRT. I wanted to thank everyone for being here today. We hope you've enjoyed this program and you have an interest in this topic or will be seeking this special distinction so that your organization can get a badge or a gold medal put on their office door. Again, thanks to the production team for making this possible, and I look forward to seeing everybody at the annual meeting in March in Fort Lauderdale. Stay safe.